Welcome to Healing Step to Wellness. I'm Dr. J.
I'm Mei.
Your trusted guide to whole person health, one step
And one bite at a
at a time.
time.
Today, we're really honored to welcome Dr. Joel Fuhrman, board certified family physician, six times,
Seven
New York
times.
Times
Seven time.
bestselling author, and pioneer in nutritional medicine. Dr. Fuhrman, thank you so much for being with us.
My pleasure. Happy to do this.
Yeah. So many people know you as a nutrition expert, but before medical school, you were a very competitive athlete. Can you share about your sports background?
Sure. I was a figure skater and I competed in the 1960s and 1970s. I competed in singles and pair skating. In 1973, I was second in the United States with my sister Gail in the senior pair division. And then I was hurt. I was ranked number one in the country in 1974 in pair skating because the number one team retired who beat us in 73. And then I got hurt and was on crutches for about 6 months. So I missed out on the 76 Olympics. I didn't have enough time to get back in great shape again after being out for so long. And then I became third in the world professional championships in 1976. So most of my childhood and young adult life up to the age of 25, all I did was ice skate the whole time, you know. And then I decided to go back to medical school. I didn't go back and attend medical school till I was just turning 30, almost 29 years old, turning 30 years old during my first year of medical school.
Wow. So, with your excellent, uh, um, as being an excellent athlete and very competitive, then what, what was your path that until you get to the medical school, and why made you decide to go to medical school?
Well, in my personal life and my family life, we were very much into excellent nutrition. My father was sickly and overweight when he was younger, and he read a lot of books by Herbert Shelton about the natural hygiene, eating mostly natural foods. And he helped his own health, and we were reading a lot of that material together. So we utilized that as part of our skating athletic endeavor to get better stamina and for athletic performance and to not get sick. So we were eating pretty healthfully through our teenage years and mostly eating fruits and vegetables and not eating junk food. It was part of our competitive training. Like Novak Djokovic, the famous tennis player today, watches his diet for performance and stamina. We did the same thing back in the 1960s and 70s. So I was into a hobby and personal interest of reading nutritional books and information and science through my athletic career. And then I had toyed with the idea of, after I retired from ice skating, of thinking I should go back to medical school and become a doctor specializing in nutritional medicine. But I hadn't had the pre-medical requirements. I didn't take the biology, the calculus, the physics. I was a business and economics major in college. So I thought it was like too late for me. And then I started meeting and dating my present wife, Lisa, my wife. So when we started dating, she was applying to medical schools and going to medical school. And I said to her, well, why do you want to go to medical school for anyway? It's like the doctors just give people drugs to deal with all the garbage they eat. And she said, well, if you're so enthusiastic and passionate about that, why don't you go to medical school and change things and do it differently? So we were having this conversation and saying that, well, I'm too old, I didn't have the right coursework, or I tried going back at night, but it was just too much. I couldn't. So then through my wife's, wasn't my wife, we were dating then. She said, well, why don't you just quit everything, quit your family's shoe business, stop teaching skating, and just go back full time to the postgraduate pre-med program at Columbia, if that's really your passion. So I did that. So when I first got married The next day, I started the postgraduate pre-med program at Columbia and went to Columbia and took all the biology and the biochemistry and the physics and the chemistry and the calculus. And I did it all in like, 1 year. And then I went back and applied to medical school. So that's what I did. I went back. So I went to medical school with a specific intent of being a physician who's focused on nutritional excellence and nutritional therapeutics.
So your interest and your study of nutrition during your competitive days, would those benefit when you got injured?
Yeah, I mean, I don't know. It just what hurt me when I got injured was the fact that I got hurt and I was ranked #1 in the country. I didn't want to not compete. I wanted to get to so I kept trying to get back on I kept trying to skate on a bad injury, and it kept getting until it got worse. I should have just left it alone and just not done, and given it the 6 months it needed to get well. But my competitive mindset and I just couldn't stay off it enough. So I probably would have been better if I just took a year off from skating and went back. And so it really didn't have to do with nutrition, I don't think. I pushed my heel, the calcaneus, I pushed the heel bone through the fat pad and split out the bottom of my foot,
Wow.
Wow. Yeah, no wonder when I was in school talking about sports medicine, the professor said we probably need to treat every athlete along with a psychologist at the same time.
Yeah.
So, Dr. Fuhrman, so then what is your inspiration? I mean, at the time that was the, I see Lisa, your wife, gave you the inspiration. Why don't you go to the medical school and then you took that path and you focus on your curriculum? And you had a family shoe business at that time. So this is kind of an interesting background. And how all of this kind of help you decide that you pursue as a medical career into really nutritarian physician?
Right. Yeah, I wanted to have as big of an impact on helping society, but my real interest was showing that people with diseases can reverse them, that the high blood pressure could go back to normal and get off medications, the diabetes could go away, the psoriasis could disappear, the asthma could get better, the headaches would go away. So my main driving force was to design these nutritional protocols based on excellent nutrition to show people that nutrition is more powerfully therapeutically than drugs, and that people with chronic illnesses can make a total recovery instead of just suppressing symptoms and modifying things with putting in poisons. I mean, even the first week in medical school, they told us that drugs are toxic and they block or interfere or poison body processes, and that we're trying to live in a manner for good health to avoid the need for medicinal substances. And that's why we have physicians to control prescriptions, to minimize the use of drugs, not to maximize their use, because if people would not minimize. And then you go out in the real world and doctors don't heed those warnings you learn in the first week of medical school. They use drugs as the sole means of impact, and they overprescribed, and they use multiple medications simultaneously, and they get people toxic, and which causes premature aging, and even promotes cancer. I'm saying right now that medicines promote cancer too, because it makes the bodies more toxic. So yes, I always felt like a passion and an excitement of being able to get a person well again, so they wouldn't need to take drugs for rheumatoid arthritis or psoriasis, or they could breathe normally without their inhalers, or they could, So the thrill was to be able to get people well again and to try to, publicize or attract individuals who were motivated, who would want to do those nutritional changes to make total recoveries. That was my desire as a career.
And as you mentioned, that people now are getting used to just taking medication, and the physicians now they know more about putting the patient on medication instead of taking them off the medication. And so, how do you motivate your patient to really focus on nutrition instead of medication?
You know, I think it's that my public persona, in other words, people would come to me knowing that's my specialty.
Mm.
So, what would a person come to see me for if they just wanted me to give them medications? Why, I could say to them, why would you pay the extra money to see me? Why don't you just go to a regular doctor if you just want medications for your condition? I'm here specifically to treat this niche of people who willing to make to make these changes. In a lot of times when people would come, I'd say, okay, what I'm asking you to do is, do you want to make a total recovery, and are you willing to do anything possible nutritionally and eat anything and everything I tell you to eat, and let me control what goes in your mouth in an effort to get a complete recovery? Or do you want to keep eating what you're eating right now? And most often they would say, Dr. Fuhrman, I'll eat sawdust if you want me to. If you can get me off my psoriasis drugs, or you can get rid of my ulcerative colitis, or if you can get rid of my rheumatoid arthritis, or if you can get rid of my multiple sclerosis, I'll eat anything you tell me to do. I'll say, great, let's do it. I'll say, then you're not going to make a decision about what to eat and what you think is right to eat and what you feel like eating and what you want to eat. I'm going to make all those decisions for you. You're not going to evaluate it right now based on taste, because we got to retrain your taste buds. You have to learn the recipes, and we got to see if this is working for you. We're going to evaluate this on efficacy. We're going to see if it starts to get you in the right direction, starts to improve your condition, you're losing weight, your inflammatory markers are going down, your medication use is decreasing, and we're going to come up with a plan. And then we can focus, in a couple of months on taste and enjoyment and learning recipes. But right now we have to test this like a scientific. We have to test the science to see that this is going to work for you, and make these adjustments to make sure we get the caloric window right in your perfect range, and we get your nutrient levels fixed and all balanced. So yeah, I would try to attract people who would want that kind of care, and motivate people who didn't want that kind of care to either try to move towards that, or realize that I'm maybe not the right doctor for them, because they're usually paying me outside of their insurance. And why would they be paying extra money if they're not going to follow my advice?
Yeah,
It's a waste of their money.
definitely. So let me pause it. And then I want to go back to your medical school time. So you say that first week at a medical school, you learn about the drug is toxic. We have to be very careful as a provider. Now, as a young medical school student at that point, you had a passion, and then you had a excellent nutrition, family nutrition focus when you were at a childhood. However, have you seen any chronic disease recovery, or any example during your student time? I'm kind of curious about, being a young medical student, what really kind of excites you further to see, yes, I know the disease can be reversed, because a lot of a young physician, they had no clue.
That's absolutely true. And you're right. You see none of that in medical school. And you see none of that in your residency or medical career, that people actually get well. Everybody just gets worse. It was prior to medical school that I witnessed that, because I was observing these naturalists, these natural hygiene practitioners like Dr. Shelton and Dr. Scott and Dr. Sidwa, who was actually reversing diseases on the front lines.
Oh.
And these doctors were not medical doctors. Most of them were chiropractors at the time.
Oh.
So Dr. Shelton's health school, which my father fasted at, and I fasted a water fast there in 1974. He had people come from around the country and stay at that facility, and you'd watch who were asthmatics getting well. So I'd watch people get well as they switched from the conventional American diet to eating these raw, natural, organic fruits and vegetables, and we'd watch their diseases go away. So I was able to observe that when I wasn't a doctor, before I even applied for medical school. I was observing that, and part of that, you could say, that was part of my interests, and my hobby was looking into that. And I would go to these health conferences and conventions run by the American Natural Hygiene Society when I was a teenager. And now that's transitioned into called the National Health Association, which is today, which I lecture at those conferences. But in those days, I was a young a young teenager in the audience listening to the doctors on stage who were my mentors, you know.
Mm-hmm.
Well, I don't know, Dr. Fuhrman. Do you recall you had a 1 day, 2 day conference in Chicago way back then in 2014?
2014. Yes.
Around 14.
10 years ago. Yeah, almost 11 years ago in Midwest.
Yeah, and there wasn't that the big auditorium. There's like a zillion people in there. Was that the one?
Yeah.
Like they filled up a huge auditorium of people.
I was there.
You were there, yeah.
I don't know you. I don't think you remember me, but I was there.
You were one of the, but Dr. J, you mentioned actually a lot of people attend
A lot.
attend
A
that conference. Yeah.
Yes.
And then something that you found interesting and you call me right at a conference. And I remember you say, "Hey Mei, you cannot believe that what I saw. This doctor, Joe Fuhrman, that he can hop up and down on the stage." And I say, "Really?" And you say he was so cool and so fit.
You're talking about using your body as a gym.
Yeah.
And so you're showing people you jump off the
Right.
stage and jump off the stage again.
Yeah, sometimes I'd put a full size, desk on the stage, and I would jump on top of the desk to give my lecture and show that people at the age of 65 or something, I could still leap off the ground and jump onto a desk,
Yes, yeah, absolutely. Yeah, but it was very fascinating for me to see you in person for the first time. And that was the beginning of us learning lifestyle medicine at the same time.
Yeah.
So, and when you mentioned about telling patients that now you decide what they eat instead of them choosing what to eat. And that reminds me, it's just like a prescription. I don't think patients would, when they get a prescription from their doctor and say, "I don't like that pill, do you have a different taste?" That one doesn't taste good. No, I don't think they'll get to choose. They get to say that.
Yeah.
And
right.
so,
And I say to them, look, the choices from what you learned and what you think you should eat and what you feel like eating and what you like to eat isn't working. Because look, you're 50 pounds overweight, you still have diabetes, you still have high blood pressure, and you have inflammatory disease. So obviously we have to make a major shift here if you want to see a big change. And it's, so you can't make the choices, but over time, I can promise you that we can retrain the taste buds and retrain your food preferences. So you will eventually like eating this way as much or almost as much as your old diet, but you'll be totally well, but that's not going to happen right away. Right now, in the first phase, you're going to still be missing the foods you're giving up. And so there might be some period of feeling a period of loss, but it's only temporary. Eventually, like eating this way as much or almost as much as your old diet, but you'll be totally well, but that's not going to happen right away. Right now, in the first phase, you're going to still be missing the foods you're giving up. And so there might be some period of feeling a period of loss, but it's only temporary for a few months. And then you're going to be feeling great, and you're going to start liking eating this way, and you'll learn more recipes, and you'll start feeling better, and your taste buds will get stronger. So just that feeling of loss and the almost like withdrawal, the food addiction type withdrawal, takes place initially, and then you have to be obviously motivated and determined to get well for this to work. You can't just, you got to really do it.
And you developed the term Nutritarian. Can you tell us what it is and how did you come up with that term?
Yes, I think it's an important term because I don't feel plant-based or whole food plant-based adequately describes the nuances of a diet that's designed to maximize longevity and maximize disease reversal. It's too wishy, whole food plant-based could be all rice, all brown rice, or mostly potatoes, or it could be almost any kind of diet. But in any case, and also, what does plant-based mean? That has an ambiguous meaning, and in scientific literature, it does not mean vegan. It means, and so it's very ambiguous as to what percentage of plants constitutes a diet that's plant-based. Can you eat 10% of animal products and your diet's still plant-based? 20%? The American diet is about 33% animal products. At what point do we call it plant-based? So it's just too ambiguous. I wanted the word Nutritarian to describe a diet that includes a portfolio of foods that have been shown in the scientific literature to maximize human lifespan and have scientific anti-cancer and longevity benefits. And so that means we're a nutritarian diets, we're paying attention to the wide diversity of nutrients and the wide diversity of foods and fibers found in the natural kingdom. And our diet is not just focused around one or two foods, but we're eating green vegetables and legumes and nuts and seeds and some whole grains and various fruits and berries. And I put that acronym G-BOMBs together. G-BOMBs, so people hone in on the idea that they're supposed to be eating green vegetables every day. We're a green vegetable dependent animal. It's not an ideal diet for us just to be living on rice and potato. We should be eating raw vegetables too. We should have both. We should have salad, and we should have cooked green vegetables, and we should have legumes in the diet, and we should have nuts and seeds in the diet too, as well as onions and mushrooms and berries and fruits. So I wanted to use the term nutritarian to be more comprehensive and to represent, this nutritarian diet is a health nut diet. It's a health promoting diet. It's designed to be held up as an ideal, a pinnacle of health excellence for people who want to know what's the best way to eat to maximize their health and make sure the body has its full.
I remember listening to your junk food genocide at one of the, I think it's American College of Lifestyle Medicine annual conference.
Right.
And when you talk about
I spoke about fast food genocide. I gave a lecture at the American College of Lifestyle Medicine a few years ago when it first came out.
Mm-hmm.
I was there too. I don't think you remember, but I was there.
Right.
We were one of the thousands people right there.
Right.
So when you try to teach your patient or the public in terms, especially this nutritarian principle, and beside the G-BOMB, how would you help them remember to know the nutrition value of the food they're going to consider or consume? And especially when you talk about nutrient dense nutrition, people will argue that how about animal products? Would you how much percentage in animal products would you recommend or allow in the diet?
Well, I was also the founder of the ANDI scoring system, which used to be up in Whole Foods. It stands for Aggregate Nutrient Density Index. And it was popular back, 10 or 20 years ago. People were using it more. But in any case, the reason why I did that was to add up all the nutrients in food, including antioxidants, the OREX score, and a phytochemical index. And when you add up all the nutrients, you see that the food's highest in nutrients per calorie are green vegetables, and animal products and oils have no significant nutrient load. They're high in a few nutrients like zinc or iron, and they're high in protein, but those aren't. But we're talking about the full spectrum of nutrients, the whole rainbow of nutrients humans need to fight cancer. And the minute you include the phytochemicals and antioxidants in there, which animal products don't have, it makes green vegetables at the top. And when they put the ANDI scores at Whole Foods Market, and they showed the darker the green vegetables with much higher scores, it functioned to improve sales of those green vegetables. The bok choy and the kale and the watercress and the collard greens sold more. There was a big kickback by the animal product industry and by the processed foods who didn't have the high scores, but they eventually kowtowed to pressure of economic pressure. But during that period when they were using the ANDI scores, they were seeing tremendous increase in sales of healthy items as people were able to visualize the high nutrients in vegetables. And we know that the same foods with the highest nutrient scores also have improvement in human immune function and the building up of the interstitial lymphocytes and line the gut and the microbiome of the digestive tract. So what I'm saying right now is that the intraepithelial lymphocytes that are the defenders of the gates of the castle that line the digestive tract, that they develop a robust protection when you have a high intake of green vegetables in the diet. And when you don't have green vegetables in the diet, they don't develop in a robust fashion. Our immune system is dependent on that. And I'm saying in general that one of the factors that drive longevity and lifespan, having a high nutrient density and diversity in the cell, is one of the key factors, cellular nutrient diversity, that drives longevity. When you're just getting, eating animal products, you don't get the phytochemical diversity from eating a wide variety of different colored plants. Because it's not just the amount of certain nutrients. You can't just pump up one nutrient like vitamin C or iron and expect to have great health. You have to have exposure to thousands of different nutrients. And a lot of those nutrients are undiscovered even. And we need a high concentration of that. And as you get a wide diversity of nutrients, including antioxidants, and diversity of phytochemicals, then the body is better able to remove toxins and metabolic aging parameters. You can say not just free radicals, but other exogenous wastes and endogenously produced wastes like urea and lipofuscin and formaldehyde and ammonia, and all these things build up in cells as they age and as they get more cancer prone. And these high phytochemical exposure activates the cell machinery that keeps those things out of the cell from building up. So yes, I'm saying that. And then, so the question you asked me was, what degree of animal products would be acceptable in a nutritarian diet? And I'm not sure the answer to that question, but let me tell you what I do see and think. I think that reducing animal products to 10% of total calories from 30% is not sufficient. It's not enough to predictably reverse atherosclerosis and significantly reduce the driving of kynurenine, because animal protein and animal fats and still drive cancer cell replication. And you start to see increases above 10%. And around 10%, it's still not ideal. You have to get down to 5% or lower in animal product consumption to see the benefits of the full benefits of a plant-based diet. Now, so the question now is, well, if you're using 5% animal products or zero, which is better, going to zero animal products or going to 5% animal products? And even though I don't have a 100% scientific support for my opinion on this question, I think that when you go to zero, you increase the risk because of the DHA and omega-3 index. When you take the seafood out of the diet, the omega-3 index could come too low, and the B12 and the zinc could get too low. And that's where we use supplements to make up for the zinc, the B12, and the omega-3 fatty acids that may put the total vegan at somewhat risk of neurological deficits in later life, increasing risk of Parkinson's and dementia. So the question is it better to supplement those things that you're not getting in animal products, or is it better to use a little bit of animal products? And I think with the pollution of the seas, of the lakes, of the estuaries, and the fact that bivalves and small fishes on the continental shelf are now heavily polluted with plastics, and even inland fish you have algae overgrowth leading to higher amounts of BMAA, which are linked to ALS and Parkinson's. So I think it seems to be wiser, if you're just looking at longevity and nutritional excellence, it seems to be more cautious to be a vegan with supplementing the few nutrients it's a little bit suboptimal in, instead of using animal products to get those extra nutrients. But still, we're talking about a nuance here, right? A nuance, and where Americans are eating all kinds of junk food, processed foods, and we use way too much animal protein and not enough plants. And we're then talking about whether a person should be a total vegan or one that includes 5%. Mm-hmm. That's somewhat, questionable, but I can tell you where I'm leaning, but I don't stop. I still would call a person a nutritarian who still ate a small amount of animal products, mm-hmm. otherwise eating a very excellent diet.
Mm-hmm.
Okay, so I remember you have been talking about the low-fat vegan diet that they may be associated with some neurological condition later in life, like that. And so another thing I really want to ask is bone broth. People have been talking about bone broth because the protein, the vitamin to build your collagen, good for your sarcopenia thing. And also their argument is, look at the old days, grandma's chicken soup heals everything. So how would you what do you say about that?
Well, you asked me like 4 questions there. Okay. I almost have to write them down to answer them in order. Okay. Yes, in the Seventh-day Adventist Health Study 2, when the Seventh-day Adventist strict vegans were followed against the non-vegans, the vegans had lower heart attack risk and overall lower cancer risk and overall longer lifespan. But the non-vegans or near vegans had lower rates of stroke by 17% and lower rates of Parkinson's. And we're saying the vegans had higher rates of Parkinson's, higher rates of strokes, and higher rates of dementia. And there are a couple of things we have to cover there. But the main factor here is we talked about those 2 parameters of aging, nutrient density and diversity, and toxins in the tissues. The next one has to do with body fat is the 3rd parameter, because excess body fat drives aging and inflammation. And the 4th one is the omega-3 index, because the omega-3 index, a low omega-3 index, interferes with the body's ability to remove neurotoxins that are then linked to Parkinson's. The body, so we're seeing that in the scientific literature, especially in 2024 and 2025, the extra science showing the link between neurotoxins and the lack of ability of the body to remove neurotoxins when the omega-3 index is low, supporting the findings of the 70 Adventist Health Study, the Adventist Health Study 2, which showed that the vegans had higher rates of both dementia and Parkinson's. And so we're saying here, because other studies corroborate that, we have many studies that show that a low omega-3 index is linked to higher rates of brain shrinkage and dementia, and also a low omega-3 index is linked to shorter lifespans in general, just a little short. So we want to maintain an optimal omega-3 index, which means supplementing with a plant-based DHA, right? To make sure your index is right above 7. And each person may need a little different amount to get their level above 7. And we're also saying that diets that are too low in fat, that don't include nuts and seeds, also do not give you maximum protection against cardiovascular death and AFib and also cancer deaths, because you need a certain fat content to facilitate the absorption of the protective phytochemicals that are found in the vegetables you're eating. Eating some nuts and seeds with the meal magnifies the absorption of the phytochemicals and the fat-soluble compounds that are so important to good health. And plus the fact that the ALA, the alpha-linoleic acid you get from walnuts and flax seeds and chia seeds, also have protective effects on the heart, not just the omega long-chain DHA and EPA, but the short-chain ALA that can convert by the delta-6 desaturate enzyme into EPA and then DHA. Just the basic ALA from nuts, from seeds and nuts, is protective against irregular heartbeats and stabilization of the membranes in the heart as well. So yes, we're trying to eat we don't want the diet to be too low in fat. We want to have at least 1.5 ounces or 2 ounces of nuts and seeds a day in the diet, plus all the vegetables. And we want to pay attention to the omega-3 index to make sure that the people who need to take a supplement are taking it if their omega-3 index is too low. So when I speak to vegan populations and vegans, I tell them, you should know your omega-3 index. Why wouldn't you, if you know your cholesterol, you know your blood pressure, but you don't know your omega-3 index, that's critical to know. And the last thing is the Adventist Health Study 2, showing more strokes in vegans, doesn't have to do with omega-3, it has to do with salt. We're talking about sodium now, because eating high cholesterol foods that increases heart attack risk also thickens the basement membrane in the brain, which leads to some resistance from the fragile blood vessel becoming more fragile with aging and bursting open and causing a stroke that's caused by microvascular hemorrhaging and the chronic inflammation caused by high salt intake. So to say that one more time, in Asian countries, we have 10 times the incidence of hemorrhagic strokes compared to the United States. And among vegans, you have a higher risk of hemorrhagic strokes, not ischemic strokes, accounting for the increased stroke risk, which means that a person, as they lower their heart attack risk, if they don't also lower their salt intake, they could be just switching a heart attack for a hemorrhagic stroke and still die of a cardiovascular-induced death. But, so we're talking about the 2 types of strokes, ischemic stroke caused by a clot and the hemorrhagic stroke caused by a bleed. And we're saying here that the bleed is caused by eating too much exposure to salt through the decades of your life, that salt has an insidious weakening effect to make the blood vessels in the brain more fragile. So we have to watch that and make sure we reduce salt intake. That's what accounted for the increased stroke risk among vegans in the Adventist Health Study too. The same thing accounts for the increased hemorrhagic strokes in Asian countries. That's why, like, the carnivore and the meat producing and the paleo and the people who were advocating more meat, and Atkins in the past, they would say, look, low cholesterol is associated with higher risk of strokes. Look, and here's a study that shows that more meat in the diet reduced risk of strokes. And they could show that study because they pulled the study done in Asian countries. Because in Asian countries, they were eating so much salt that when you cut back animal products, the salt intakes imparts hemorrhagic stroke even more, and they could show more strokes in Asian countries in people cutting back on animal products. So, but it's not that the animal products prevents the stroke. It's that salt becomes a bigger risk factor when you're not eating animal products.
So,
wow.
Yeah, I remember that's also related to brain health, because those small hemorrhagic stroke in the brain, that they call it lacunar stroke, the burst open of those tiny blood vessels, people don't even realize it, but gradually reduce the brain mass and cognitive like that.
That's right. And also, salt intake is linked to tau protein buildup in the brain and Alzheimer's as well. It's a contributor to Alzheimer's disease. So, we have universally across the United States, but in almost all across the world, people are consuming salt intake as one of the major causes of death across the world, excessive salt intake.
So, Dr. Fuhrman, you suggest people to, it depends on the type of the nutrition intake. So for vegan group, then you encourage them watch the omega-3. And how do you advise people? How would they know how much is supplement dose that they should take? Because right now we have seen a lot of people, they loaded with a lot of vitamins and they grab all this information from very convenient Google doctor. So what is your suggestion on that? How we balance the necessary vitamin versus the the nutrient dense eating?
Right. Well, the three primary supplements that could be low on a vegan diet are B12, zinc, and EPA, DHA, and DHA. So how much B12? About 100, 75 to 150, around 100 a day for vegans, more than the RDA because you're taking it usually in a supplement. So usually around 50 to 100 B12. And zinc, just take the RDA. You get zinc in a plant-based diet, just the phytates bind it, so you're not absorbing it as well. So you do recommend a little bit of zinc, extra zinc, like 10 milligrams. And then how much DHA is, I'm very specific here and saying that the amount of DHA you take should be individualized to your needs based on blood work. So some people may need none, and some people may need a lot. And that should be individualized based on your particular genetics. And that should be determined by a blood test called the omega-3 index. And the most accurate one is called omega quant. So that's the one I think that has the most, the studies is done on it, the omega quant blood test. And so and that blood test runs, I think the range could be like 0 to 12, and we're saying people should be above 6 or 7. Above 7 would be ideal to get, because you could start with a dose of EPA and DHA, and if your level is still 4, you may want to double the dose and take twice as much until your level goes up higher. Now, 10 years ago, I used to tell people if they were vegan, keep their level above 4. But over the years, with more studies coming out, I eventually moved up to keeping it above 6, and now maybe keep it above 7, because we're seeing the most beneficial effect on brain health in later life. The most protection occurs with higher levels, so it is better to probably take more of that stuff.
I just did my test, so I need to go back to see my results. So one question I previously asked was about bone broth, because the argument is for the amino acid, for the building the muscle, collagen, and also the proof they say was from the grandma's chicken soup, heals everything. So what's your opinion about the bone broth?
Well, I'd say, I try not to have too many opinions, but to try to really seek out the scientific reasons and the scientific studies to see where they point to, right? And so you're talking about internet myths and people discussing things on the internet, and most of those things are studied. So if we look at the studies on bone broth, we could see that they don't have a lot of supportive evidence. And the nutrients, there's a low level of nutrients in there that are also found in plant foods. There's nothing, most of the collagen, the little bit of collagen you get in bone broth is broken down into its various amino acids. Some of the bone materials have more lead in them, or expose you to more lead. It's not usually a high calcium product, even though it's made from bones. It's much probably better to take a food-based or a a seaweed-based calcium. But the point is, I don't think it matters much whether you take bone broth or not. As long as it's not high in salt, it's not going to be a major element reversing disease. And so it's certainly better to have bone broth than to have a high salted substance, or to drink an electrolyte drink, which is really garbage, or to drink Gatorade, or to drink soda, or to drink, certainly better to drink bone broth than other things that are more damaging, like sugary drinks, or to use it as a base of a soup to put vegetables in it. I'm not totally against it, but I don't think it's a miracle food either. But I think nowadays we have like AI search engines, and you could say, out of the 30 or so studies done on bone broth, how many were positive and how many were negative, didn't show much, and what are they? Is there a lot of evidence to suggest that it has value in it as a nutritional supplement? And I think most of the evidence shows that it's questionable. There's not much evidence showing its efficacy for almost anything.
Dr. Fuhrman, so you have seen a lot of a patient over several decades, and I assume you have all kinds of tough diseases, cases that come to you. Can you give us an example that what kind of a disease is that as a good example to prove to people that never too late and you always have a hope?
Yes, definitely. And I could talk, I have so many great cases because, as you know, I've been in practice now for more than 30 years and maybe in 35 years. So yeah, I have so many great cases. I have an example of one case. Her name was Lee Gerstead. She passed away now, but she had metastatic breast cancer into her bones. And the doctors didn't even recommend chemo at that point. And she made a complete recovery through, I put her on, a green vegetable and sprouts and vegetable juicing. And it went away completely. Even the bone mets went away. Even when I got the bone scan back, I said the doctor, called up the radiologist, 100 Medical Center, when in New Jersey at the time, and I said, you must have mixed up her scan with some other patient because it's clean, and then she had mets, and he said, no, it's gone. So I made him repeat the test. I thought he mixed it up. But yeah, I've seen a lot of cases of, and I had women. I have multiple women with lymphoma that without chemo just melted away. Without radiation and chemo, the lumps of lymphoma lesions, non-Hodgkin lymphoma went away. Amazing. I had a young woman on the National Renal Transplant list waiting for a new kidney because her lupus caused lupus nephritis with a creatinine of 4.2. And while she was waiting to get a kidney transplant, she followed the Nutritarian diet, and her lupus went completely away, and her kidney went back to normal, and her creatinine dropped now to 0.8, from 4.2 to 0.8. So I've had people with, for example, having, bleeding 16 bloody bowel movements a day with ulcerative colitis, having to travel with a toilet in a minivan to go and to do anything. And so, as a matter of fact, this person was in the hospital getting IV steroids because they couldn't stop the bleeding. So when he left the hospital, I had him come and live in my house.
Oh.
Yeah. He lived in my house for like a couple of months. And I was fasting him after we got out of the hospital and just feeding him. Then I was feeding him just zucchini, just steamed zucchini, and then steamed zucchini and white potato without the skins and mashed potato for like a few weeks. I eventually got him on cooked vegetables and got him back and eventually healed his gut and healed his body so he didn't have ulcerative colitis anymore. And I had another guy who had ulcerative colitis treated with drugs, which resulted in him getting testicular cancer. He had a seminoma, and he switched over and treated his with my anti-cancer protocol, and he got rid of his cancer, and his ulcerative colitis went away. Both those things all went away, just disappeared. And so we have and I've even had patients with metastatic ovarian cancer. One woman, she's still alive today. I shouldn't give her name, but anyway, this was about more than 20 years ago. She had metastatic ovarian cancer that caused the collapse of her left lung, and she had 4 liters of fluid taken out of her lung, of metastatic fluid taken out of her lung, and she took chemotherapy, but she was still given a very poor prognosis because the chemo doesn't kill everything, and it always recurs and comes back. But I think that debulking most of the tumor and most of the mass, the infiltration with chemotherapy benefited her, because then the Nutritarian diet and the regimen then kept the immune system was strong enough to defeat any stray cells or stem cells that could have impacted and come back and cause recurrence. So these ovarian cancer cases I've had, numerous, many of them, shouldn't say many, but I've had several, not a lot, but I've had enough cases of ovarian cancer where the patients are now thriving and living many years later after being, whereas in conventional doctors, conventional oncologists have no cases of ovarian cancer that are living out 10 years or more, a year or more after chemo, it's metastatic cancer. So yes. And then I have advanced people who were like in the hospital, in the ICU with heart disease that were near death, right? That were, that switched to on many doses of insulin and had infection and people who were, were not coming back to normal rhythm again, how to shock them back into normal rhythm. So I've had permission to put the Nutritarian diet into the hospital and watch these people be able to get out of the ICU and get well, have their family bring the food into the hospital and get rid of their drugs and get their immune system built back and recover from very, very severe heart disease. And I even had a person who was paraplegic given tube feeds, and they allowed us to switch his feeds back to when he was becoming infected. And he was really becoming really sickly, almost in a hospice-like situation. And we were able to feed him a Nutritarian diet through first a G tube and then through a G tube. And he eventually, he was eventually able to stand, but he still got hurt very badly, but at least he survived. So I have one case after case after case. Of people who've headaches so bad they couldn't work anymore or couldn't go to school, and back to getting rid of their getting rid of headaches. So yes, there's a broad application of nutritional excellence and help people make incredibly, even miraculous type of recoveries.
Well,
wow,
right
amazing.
now there are a lot of issues with autoimmune. So
Yes.
There's one listener question on Sjogren. Have you some cases with Sjogren?
Yes, autoimmune disease in general, Sjogren's, connective tissue disease, and I didn't Venus Williams, the famous tennis player who left the tennis tour, have Sjogren's disease, and she switched to something just like a Nutritarian diet, right? She went out and she got well and got back on the tennis tour again. So yes, we've seen these autoimmune conditions reverse themselves. They sometimes need tweaking or individual guidance. Sometimes more high, like EPA fatty acids. Sometimes, like for example, people with lupus should not have alfalfa sprouts, and people with Crohn's and colitis shouldn't have nutritional yeast. And there are certain, in quinoa. So there's certain things that we make adjustments to, but most autoimmune diseases can be improved or reversed unless they advance too far. There's certain deterioration and body damage that can occur. So like I've had many cases of multiple sclerosis that have gotten well. There's called relapsing and remitting multiple sclerosis. And we can see on MRIs that the skip lesions and damage in the brain is getting better and goes away, gets back to normal again. We can see that. Of course, there are cases of multiple sclerosis that are progressive, that have progressed too far, but they can't be reversed. Just like there are cases of rheumatoid arthritis that have reversed too far that we can't reverse everything. But if we caught these things early, we'd have more predictable reversal.
So, at what age do you determine at any age that is it too late, or any age it's never be too late to get
No, I
started?
don't. No, I don't usually say it's too late because people usually want to live longer and be healthier no matter what their problems are. Even if you can't get a person totally well, you still want to maximize their health from wherever they are, you know. Um, so
As long as they have a will, then
if
very
right, if they're
yeah.
motivated and have a will to live and they want to do whatever they can, you know, sometimes I'll see a patient with an advanced cancer and I'm saying to myself, this cancer is too advanced that they don't, maybe they should just go out and eat whatever they want and just, because it's probably too late to reverse this at this stage. And sometimes the patient will say, and the family will say, they really want to have hope and they want to do everything they possibly can to maximize their chance, even if it's for an extra month of life. And they really want you to do everything you can to help them know what's going to prolong their life the best they can, even if a total reversal is not possible. Whereas another person might say, if I'm just going to die anyway, and I might as well just go and eat, do whatever I want. So it's really a personal thing, an individual choice at that point in life, whether a person wants to adopt a more rigorous nutritional program or not.
Wow.
Well, since we're going pretty long, going out of time very soon, so I think that's one of the most important questions for Dr. Fuhrman.
Bring it on.
Okay.
Not four, one.
What's your diet like in a day? What do you eat in a day?
Yeah.
What do I eat in a day? Okay.
Yeah.
In the morning, I have a tablespoon of ground flax seeds or ground chia seeds and a tablespoon of raw wheat germ protein, raw wheat germ flakes, raw organic wheat germ flakes. And I'll put that with maybe a cup of berries or wild organic berries, frozen cherries, or sometimes I'll put organic dried apricots that are California apricots that I cut into little pieces and I soak them in soy milk. And I put the soy milk or almond milk in there. So now sometimes I'll put maybe put a little grain in there, but like a little bit of oat in there, but usually not, maybe not. Maybe I just have the seeds with the with the with the nuts and seeds, with the milk and the fruit. So and maybe a peeled orange or something. And then for lunch, I'll have a big salad and if I'm not having vegetable bean soup with the salad, which I usually don't, I usually have that at dinner, the vegetable bean soup and green vegetables. So usually I have the big salad and I'll put some beans on the salad. I'll put like soybeans or black beans on top of the salad. And the dressing I use, and the salad will have red onion and arugula or watercress and a half a jar of sprouts onto the salad too, and half lettuce. And so there's beans in there, there's lettuce in there. Maybe I'll soak some dried goji berries in orange juice, and I'll use the goji berries sprinkled in the salad, or I'll open a bag of frozen pomegranate arels, and I'll add the pomegranate in the salad with the cut up tomatoes too. And maybe I'll make the dressing with soaked dried tomatoes made with nuts and seeds, with almonds and sun-dried tomatoes and roasted garlic and a little soy milk. I'll make a dressing out of that for a Russian dressing. And maybe I'll take some sesame seeds and lightly toast them in a pan and sprinkle them on top of the salad too, So I'll usually have a big salad, a lot of stuff in there, trying to chew it real well. And at dinner, I mostly have cooked stuff, because lunch I had mostly raw stuff. So dinner, I'll have like a cooked mixed vegetable with cooked mushrooms and snow pea pods and cooked cabbage and broccoli, or a bean vegetable soup with mushrooms, a lot of mushrooms and onion and beans and broccoli and collards and, bok choy in the soup, or a stew. And sometimes I'll take, last night I took Brussels sprouts, or I took regular sprouts and I put them in the hot soup. I let them sit in the hot soup. It was a tomato-based soup that had a mixture of beans in it, So I'm usually having, and then maybe for dessert, I'll have some dried figs from my own trees, or I grow bananas, or I grow figs, or I grow certain fruit here on the premises, and I have so much when they come in, I have so much figs that I'll take a lot when they're in season. I'll freeze them. I mean, I'll dehydrate them a little bit. I'll dehydrate them and then I'll freeze them, the dehydrated figs, and I'll have some maybe figs for dessert or something. figs with a little almond milk for dessert. So that's and I had maybe some pistachio nuts. Oh, with my dinner, I cracked open and had pistachio nuts, or with breakfast or lunch, I cracked open and had some walnuts. So yeah, had a little of that too. So that's like a typical day.
Wow.
Is that something close to what you guys are doing too?
Yeah, we have been.
Something
Except
like that.
the wheat germ.
Yeah.
We have not explored wheat germ yet.
I do the raw wheat germ protein. I think I buy it on Amazon called Ktheos, I think the brand name for the raw wheat germ, because wheat germ is high in spermidine, which is another anti-cancer longevity compound found in wheat germ. Is really good.
Wow.
Yeah, I'm more addicted to tofu, so I have to have tofu every day.
I eat tofu too. I have some tofu. And I'll tell you, I got to tell you, I do the tofu, okay? I take the extra firm tofu, the super firm, and I cut the block into 5 sheets. And I lay the sheets of tofu now on my dehydrator pan. And I put on the top of it a mixture of tomato paste and tomato sauce and my Thai curry sauce. I mix in there to make a really thick tomato-based sauce, tomato paste, tomato sauce, and Thai curry sauce. And I pile on the sauce on top of the tofu squares, and I dehydrate them for 20 hours at 130 degrees. And I make tofu pizza jerky. So it's real chewy and rubbery, and this red sauce compacts down and gets concentrated. It's so delicious that my whole family and it's great for travel on the trips and everything. Yeah.
Wow.
Tofu pizza jerky, dehydrated tofu with tomato sauce on top.
Wow.
Was that in your book?
Cookbook?
Yeah, I'm sure those recipes, a lot of them are in the book too.
Wow. Dr. Fuhrman, this is so inspiring. We can be on and on. So I remember that I think I spot that you have a class for to train people being certified as a Nutritarian coach.
Yes, I do.
So yeah, so I'm going to check into that because this is fascinating.
Terrific. Thank you. All right. Well, thanks for having me on, and best of luck to all of you and all your listeners. This is such exciting, the great work you guys are doing.
And we are very excited for you to come to virtually. We'll speak at our conference on April 10, our annual conference. There's a symposium. So you are going to talk about the longevity with all this the very valuable information on the Nutritarian diet versus the longevity. We're very excited. Yeah.
So, how can people learn more about you besides drfuhrman.com? I believe you also have a podcast.
Yes, on YouTube we have the Eat to Live podcast, but on drfuhrman.com, if they go to the blog, the resources, and go to the blog, they can watch them without commercials. They could watch, but if you go on YouTube, you still have to get some commercials in there. Our Eat to Live podcast, which are really fun. I do it with my daughters.
Yeah, Jenna.
You've seen that? That's great.
Yes, I watch it all the time.
Yeah, and then that's so cool. All right.
Well, let's summarize a few key points from today's conversation with Dr. Fuhrman. The food is really not just calories. No, it's just like a prescription if necessary. And secondary chronic disease is not inevitable. We can always get the right nutritional strategy, and many conditions can improve or even reversed. And third, becoming Nutritarian doesn't require perfection, right? Just intentional and consistent steps.
And never too late to turn around and eat a happy, healthy longevity life. Be very productive, very sharp.
Great.
Yes, thank you.
Thank you so much.
Okay, thank you guys.
Thanks for joining us on Healing Step to Wellness. I'm Dr. J.
I'm Mei.
Guiding you toward whole person health, one step
and one bite at a time. Thank you so much. Bye. We'll see you next time.